Hey guys, Herbal Prepper here, and today I wanted to, sorry, I had to make sure the camera was on. Today I wanted to just briefly explain where I've been. Now I know I've been absent for quite some time, and I wanted to kind of give you guys an explanation. So, as a lot of you know, I was due at the end of May with my second born son, and he came in June. Unfortunately, when he came, we did not know that he was going to be born with a heart defect, a very serious heart defect, called a partial AV canal or partial atrioventricular canal defect. About 45% of babies with Down syndrome have this defect. Now, my son does not have Down syndrome. So the surgeons made a statement that was very interesting, that because he does not have Down syndrome, he has a more severe case of AV canal. So it's almost like a blessing in disguise to have Down syndrome, which Down syndrome comes with a bunch of other, lung issues and, things like that. But so it's almost like, just you're just stuck either way dealing with a heart defect. They're no fun. And so he has spent most of his life, he's almost 10 months old, so he has spent most of his life at Children's Hospital. He has underwent 3 heart-related surgeries, 2 being open heart surgery. And so let me just briefly explain. The first one was to try and repair his own tissue. Basically, they wanted to fix the hole in the heart, because that's the canal part of the defect. And they wanted to fix that, and because he had severe mitral regurgitation. Mitral valve is on the left side of the heart, the tricuspid is on the right. Because he had severe mitral regurgitation, they wanted to try and repair that as best as they could, and just hope it worked. Unfortunately, it did not work. The patch worked, basically putting a septum there. That worked. To my knowledge, that's not caused any issue. The regurgitation was still pretty bad. He ended up going into cardiac arrest. We almost lost him at that point. They, of course, started chest compressions. They started CPR instantly. They were in the room with him when it happened, so that was a blessing that they were present. It doesn't take very long once someone goes into cardiac arrest to lose them. So you have seconds. So with that being said, he ended up having to go into for another surgery. His second surgery, they removed his mitral valve that they tried to repair, and they put in a mechanical one. The mechanical one's goal is to function as a normal, for the most part, as a normal valve would. That's basically lets the blood come from the top chamber down to the bottom, and it doesn't let it go back up. So that's what it's meant to do, and that's what it does. The downside of having anything metal-wise, mechanical-wise in the body is you have to prevent blood clots. And it's not just an aspirin thing. You have to be on Coumadin, which is a very, very, very strong blood thinner. Downside of that is if you ever get into a car wreck and you have a huge laceration, it is going to be especially if you have an arterial laceration, it's going to be, your chances of making it are not going to be good. You're going to bleed out very fast. It's going to be very difficult to reverse the anticoagulation, and so that is a risk. And then hitting your head and having brain bleeds and things like that. So that's always a risk. And unfortunately it's one that we have to take on a daily basis, just because he does have that mechanical mitral valve. Now, when they were putting that in, the surgeon stitched through the electrical component of the heart, which stopped his heart, which is called heart block, and so now he needs a pacemaker. So he has a mechanical valve and a pacemaker. And then and that was a week later that they had to do that, because there's a small chance that maybe the heart recovers after surgery. I think Boston Children's did a study, and it showed that after about a week, no one really recovered from complete heart block. So they went in a week later, reopened his sternum, and put a pacemaker down in his stomach because they're too small right now. The babies are too small to have them in their chest up here. So long story short, he ended up getting a G-tube. He's now home, but he has spent, he's almost, let me see, 9 months. He spent about 7 months in the hospital. So that's kind of where I've been, guys. Because he has such bad myopathy, poor, ejection fraction, and congenital heart defect, and lung issues because of the heart issues, and blah, blah, blah. He may need to have a heart transplant. I am not giving up on his little heart yet. I am going to keep going and keep fighting and doing whatever I can to keep him from having a heart transplant, because that's not a cure, guys. It's just a bridge to the next heart transplant. And the older you get, the more antibodies you build up, the more likely you are to reject a heart or not find one that's a match. So that's a road I don't really want to take until I ultimately have to take it. And so here we are today. My son is, about 9.5 months old. We deal with multiple medications. We deal with doctor visits. We deal with just a medically fragile child on a feeding pump, and things like that. We deal with that a lot. Okay, so I won't be able to make as many videos, but I will do my best to get around to you guys as soon as I can. But I just wanted to really take this as an opportunity to present two things to you guys. My medical savviness, my herbalism, my knowledge in general of the human body and the medical whatever is what helped to get my son, oh, someone just bit me, is what helped to get my son diagnosed. Without that, we might have went home because they had cleared him. So what I'm trying to say is this channel is about preparedness in multiple different ways. And guys, I would strongly urge you to go and get prepared. And I do mean spending money on your education, whether you go and take a, EMT course, or you go and do CPR classes, or a nurse friend who would, pass on some of her knowledge, or, whatever. I really, really strongly feel that if you've been contemplating on that one prep, putting it in your back pocket, and it's just so expensive, don't contemplate anymore. This is knowledge that you can use in real life to help you or another. And I'm living proof of that, okay? It is very important that you get as much knowledge under your belt as possible to help your family. And I do strongly suggest you get on Amazon or wherever your buying online choice of preference is, and buy things like stethoscopes. And you can get a cheap one, $35, and it works for the most part. But you've got to learn what you're listening for. Things like this, guys. Those are the things that is well worth your money. It's well worth your time. Pulse oximeters. That's one of the things that they stick on your finger, checking how much oxygen you have. Well, that's another thing that you can buy. And guys, I want to segue that into the second point on this video, is that you please, whenever you have a child, or someone's had a child, just mention them, hey, I have a friend, or I know someone who had a baby with a congenital heart defect. It's the #1 birth defect. Did you know that? If not, likely they didn't. If not, tell them, hey, just maybe when you're having an ultrasound, have the doctor look over the heart really well. And if they ignore you, just say, also you can recommend or ask your nurses or doctors after the baby's born to put a pulse ox on them, just to make you feel calm, and typically they will. I think even Georgia has now put out it's a bill or something that they're thinking about. It's mandatory for all babies that are born in the hospitals to have a pulse oximeter put on them before they're 24 hours old, before any newborn testing, in other words. And so, I'm not huge into, government mandates and things like that, but I do strongly feel like it doesn't hurt, guys. And at the very least, you need to be medically prepared and know how to handle these things and know how to identify, because it was because of my persistence that ultimately led to my son's diagnosis. When he was 24 to 38 hours old. And then the third thing is, guys, just when you do these classes, or you do these, herbalism or whatever it is that you're looking to take a path in, do it in knowledge of today and the future. Just don't think doomsday, or whatever it is that you're prepping for, you have in your thought that's going to happen in your mind. Prep for the now too, guys, because while you prep for the future, the now is happening. And so I hope that my videos are always a blessing to you guys, and I hope that whatever you glean from this video is useful for the future for you, whether it be just congenital heart defect awareness, that's what this shirt is about, or whether it's about learning how to identify heart conditions and how to treat them, until you can get to someone who knows more, like a doctor. These things are very important, and I hope as I learn more, I can share more with you, and I hope through our trials and tribulations and our blessings and the road we walk and the journey that we walk on, we can share as much as possible with you guys. So guys, until next time, shalom, and I hope the video is a blessing to you.